Hi, my name is Olivia Newsome, and today I'll be presenting the axial skeleton. The axial skeleton consists of the bones that lie around the longitudinal axis of the human body. Some examples of axial bones are the cranial and facial bones, ear bones, hyoid bone, the sternum, and bones of the vertebral column. There are 8 cranial bones from the cranial cavity. Some in the cranial cavity are the frontal bone, the parietal bones, the temporal bone, and the occipital bone. There are 14 facial bones. There are 2 nasal bones, 2 lacrimal bones, the 2 maxilla, 2 zygomatic, 1 mandible, and the cranial and facial bones protect and support the brain and special sense organs. Here are the cranial bones. Here's the frontal bone, the parietal bone, the ethmoid bone, things like that. Here are some of the facial bones. I couldn't put all of them on there because there's 14 of them, but there's most of them pictured here. And then there's different types of bones, such as the long bone, the short bone, and the flat bones. The long bone is greater length and width and are slightly curved for strength. Short bones are cube-shaped and are nearly equal in length and width. And flat bones are thin and composed of 2 nearly parallel plates of compact bone tissue, enclosing a layer of spongy bone tissue. Irregular bones are complex shapes and cannot be grouped into any of the previous categories. Sesamoid bones protect tendons from excessive wear and tear, and sutural bones are found on the skull and located in sutures of cranial bones. And then you have depressions and processes. And depressions allow the passage of blood vessels, nerves, ligaments, tendons, or they form joints. And processes are projections or outgrowths that form joints or serve as attachment points for ligaments and tendons. The hyoid bone does not articulate with any other bone. It supports the tongue and provides attachment sites for some tongue muscles, and it also helps to keep the larynx open at all times. And then you have the vertebral column, which is also called the spine or the backbone, and it functions to protect the spinal cord, support the head, and serve as a point of attachment for the ribs, pelvic girdle, and muscles. The column is curved to varying degrees in different locations. And then you have the cervical. The atlas is the first cervical vertebrae, which supports and balances the head. It has 2 depressions that articulates with occipital condyles that allows movement up and down / nodding. And then you have the thoracic vertebrae, which articulates with the ribs. It has facets for articulation of tubercle of ribs, and it has facets or demifacets for articulation of head of ribs. Then you have the lumbar vertebrae, which provides for the attachment of large back muscles. Then you have the sacrum, which is a triangular bone formed by the union of 5 sacral vertebrae. It serves as a strong foundation for the pelvic girdle. And then you have the coccyx, which is triangular in shape, and it is formed by the fusion of 4 coccygeal vertebrae. And then you have the 12 pairs of ribs, which give structural support to the sides of the thoracic cavity. They increase in length in the first 7, and they decrease thereafter. Each rib articulate posterior to the vertebrae. And then we have some anatomy purpose games. Just have the axial skeleton, which is anterior and posterior. It goes over the body of the sternum, the sacrum, the xiphoid process, the manubrium, the coccyx, the skull, the scapula, the thoracic vertebrae, cervical vertebrae, ribs, and clavicle and lumbar vertebrae. And then we just have the vertebral column quiz. It goes over the sacrum, the atlas and the axis, lumbar and thoracic and cervical vertebrae. And that's all today. Thank you for listening to my presentation.